Hello family, welcome or welcome back to my channel. If you're new to this channel, you're welcome, you're on the right track. Please join the family by clicking the subscribe button. It's just for you to join us and you'll be able to get even alerted whenever I post another video. Thank you for joining us. Today we're going to be talking about how to become a nurse in the UK. If you want to be a nurse outside your country, UK is a place you should consider. If you've seen my other videos to see the benefit, you can see reasons why UK should be an option. I'm going to be telling you the process of becoming a nurse in the UK. First of all, make up your mind. Make up your mind. Once you've made up your mind, that is the most important stage of being a nurse abroad. Make up your mind that you're ready to relocate and you're ready to face everything. And I'm telling you, it may not be easy, it may be easy, just be prepared. And once you've made up your mind, I would say you should try to get your English exam sorted. Some people will ask, should I do my IELTS first, or should I do my CBT first, should I do my OET first? From my own experience and from what I would think you should do your English exam first and clear that before you start applying or before you go on to doing your CBT. Because I've had a lot of cases where a lot of people will go and do CBT first, which is the computer-based test, and then they are struggling to pass the English exam. CBT is the easy part of the process. It is not something that a lot of people fail. I've never seen anyone who said they fail, although you still need to prepare to pass your CBT, but it is not as difficult as the English exam. So once you've cleared your English exam, it can be OET, it can be IELTS, it can be a letter from your school if you're in the country where you're eligible to use your school reference that you can speak English and you don't need to take the exam. Once you've had that sorted, then you can progress onto creating accounts on the NMC website. When you go to the UK NMC website, you'll be able to open an account for yourself, input your name there. They will ask you for your passport, for that which is your travel documents and evidence that you're registered in your country, which is going to be your certificate of registration. And as long as you're a nurse in your country, you've got license, either diploma nurse, BSc nurse, and you've been in school for nothing less than 3 good years, you're eligible to apply. And you're going to pay a fee of £140, which is non-refundable. So that means even if your application is refused, you are not able to get this money back. Once you're eligible and you've already passed your English exam, depending on what you're taking first, if you decide to do your CBT first, then you need to open a Percivale account. And remember, once you're opening your NMC account, that account you're opening, remember to keep all the detail, your login detail, the name, and use the name on your passport, please, so you don't have any mix-up when it comes to applying for your visa or for your PIN. Remember to use the name that you're using that is on your travel document, which is your passport. Remember to use the name for your NMC registration, so there's no conflict or there's no difference, and they will ask you to be providing the reason why your name is different. Try to remember all these things, remember the detail and the login detail, because even if you're going to be 20 years in the UK, it is that same login detail you started with, you're going to continue with. That's where you're going to do your OSCE. That is what you're going to use for your PIN, your renewal, revalidation, everything you're going to be doing in the UK that has to do with NMC will be done on that account. So you have to remember to keep the account safe. So once you have been able to open the Percivale account, CBT used to be a 120 question, which is multiple questions, but now starting from August 2021 is going to be changed into 2 parts, which the first part is going to be numeracy, and it is 15 marks. It will last for 30 minutes, while the second part will be the theory, which will last for 2 hours 30 minutes, and it is 100 marks. If you're able to pass this stage, it is not really difficult. Just make sure you use the Royal Marsden, which you can either download the soft copy or buy the hard copy, borrow from someone. Just make sure you read, because the Royal Marsden is like the nursing manual in the UK. You need to know what is in the Royal Marsden, especially the codes, the law, and they're just basic everyday questions that you'll be asked in the exam. So it is nothing you should be worried or scared about. The document you will need to upload include your health check declaration, which is going to be a certificate of good health from your general practice, your general practitioner, someone who already know you, someone you've been seen to say you're fit to work and you've not got any major reason why you cannot work as a nurse in the UK. You need your police clearance from any country you have lived for at least 12 months in the last 10 years. If it is 2-3 countries you've lived, you need to provide the police clearance for those countries. You need to show 3 years reference, which is covering the years you've worked, if you've worked for 3 years. If not, depend on your employers. There was a change to say they don't need your experience. You can even be a new graduate and come and work in the UK, but some employer will say they want 1 year. So it depends. If you've got any experience, you upload your reference from the employers. And remember, if you're going to use anybody as a reference, remember to inform them, to tell them you have used their name or you've used their company, you've used their work for reference, and they should expect mails or calls, and they should please respond, because some they will send mail to your reference and your reference will not answer. It will just keep delaying you and your process will become longer. Of course, at this point, like I've advised, you will have had your English, your proof of English, which can be either through OET, IELTS, or a letter from your school if you're in one of the countries where you are eligible to use a letter from your school to say you were taught or you were trained in English. That may cover you, but check to be sure that your country is among the countries that can use this letter. Other than that, you're going to submit your OET or your IELTS. Then you will need, at this point, you will need to wait. When everything is processed, they're going to check to make sure these are correct. They will contact your school of registration, contact your reference, and once everything is cleared, we used to call it decision letter in the past, but someone said it is now called invitation letter, where you're invited to come to the UK to come and do your OSCE, and you're going you're already halfway, almost even over halfway into the process. And by this point, you need an employment. You need a job, or you need an employer, you need an agent. Some will go through agents to come to the UK. The agent, what they do is just be an intermediary between you and the employer. Some agent, they already have slots, or they already have companies they work with. So when those companies want nurses, they will just interview you online. They will arrange interview between you and the company, either NHS, care home, private, whatever it is, and you will do the interview online. If you're successful, you'll be given the job. I've seen a lot of people also who want to do this process themselves. They just go to the website, either NHS websites, the home they want to go, and they will apply themselves and they will get interviewed and get the job. Although I know because of this travel restriction and everything that is going on just now, there's a lot of delay to people traveling. A lot of nurses are still getting into the country, registered and employed. So you can do it. Just don't give up. Keep up and continue your process. Continue having the faith, and hopefully one day you'll be able to get to the UK. So at this point, you're going to try to get a job, like I said, either through agent or by yourself. And remember, please, when you're getting your job, I cannot hammer this enough. Remember to make sure you read your contract, know how many hours you're going to be working, know what is involved in your contract, know where you're going, know the location. These are the things you should put into consideration when taking a job. Don't just look at the salary. Ask for how much it is per hour. How many hours are you going to be doing? Are you going to be able to cope? Where is the place? What is the location? How far it is from things you may need. If you've got family, how far is it from school? Just are the things you're going to put into consideration when you're taking a job. And once you've gotten the job, then you'll be able to use their certificate of sponsorship that they're going to issue to you to apply for your visa. They will send you a certificate of sponsorship after they've already maybe advertised. There's something they have to do which is not even your business anyway. They have to show the UK government that they've tried to look for somebody in the country locally and they couldn't find. So just take some time and then they will get back to you. They've given you the job and now they will send you the certificate of sponsorship, which is usually paid for by your employer. Some employer also sometimes will pay for your CBT, or they will refund you the CBT. Some will refund you for your IELTS, but depend on what is in your contract, what you've bargained with your employer. Some will not. Some will do the salary deduction. So once you've gotten your letter to say you can come and you've gotten your certificate of sponsorship, you can now use this to apply for your visa. So what you need to do, either your company will direct you on how to do it or they will apply for you. Then you need to go to the UK website and apply for your visa, which if it's a fast track, if it is a regular one, you get your visa, maybe the decision at least within 15 days. And remember to use the correct postage if they're going to post your passport to you, or have a center that is close to your house for easy access where you can go for your biometry. And during biometry, people also ask me if they used to ask questions. Like, they don't ask you, except maybe they have concern or they have query about your application. But of course, you're a nurse, you've got your job. So what they will just do is take your fingerprints, snap you, just do your biometry, and then you wait for your visa. Most of the time, if everything is all right, you get your decision within 15 days, and then you're ready to come to the UK. So you start preparing, unpacking your bag, arranging accommodation, which will be maybe sorted by your employer, and then you're ready to take that flight. Getting to the UK, you'll have to now at least attempt OSCE. You can take OSCE exam 3 times. Even if you fail the first, the second, at least you have 3 attempts to pass OSCE. You have 3 centers where you can take your OSCE once you're in the UK. You have the Ulster University, you have Northampton, and you have the Oxford University. Those are the 3 centers you can take your OSCE. Initially, we used to have 2 skill stations and 4 API stations, but now little changes has been added, which now involves your 4 API sections still continue. API being assessment, planning, implementation, and evaluation. And these 4 stages, the same patients you've got in your assessment stage, maybe when they come with whatever medical condition, so A&E, they've got UTI or whatever disease come with, is the one you're going to assess. The P for planning, you're going to plan the care plan. What are you going to do for this person? You're going to look at what you can do for them. Implementation, mostly usually medication. You're going to serve medications and you're going to use all the 7 rights. You're going to do everything according to the NMC standard. Evaluation, you're going to assess this thing you've done. Does it meet the standard, or have you been able to achieve what you wanted to achieve? If it is not achieved, if the goal is not achieved, when is the next target, or what is going to be the next plan? So it is the same patient you have from your assessment up to the 4th stage. So in the 4 stations, you have the same case scenario that you just carry along, and you just take care of them from the time they get to you until the time they are going to be discharged, probably, or until the time their care is going to maybe towards ending. So that is what you have at the API section. And now they've added few more stations, which include, I'm going to leave this on the screen. This include what is going on now or in the past and what is going to happen in the future. So CBT previously used to be 120 questions and it usually lasts for 3 hours, but now it is now changed to part A and part B, and the mark will be, part A will be numeracy, which will be 15 marks and 30 minutes will be the time, while part B will be 100 marks and 2 hours and 30 minutes will be it is still the same 3 hours, so just that it's divided into 2 parts. And now the OSCE, initially we used to have 6 stations, like I've said. First station will be the API, the assessment, planning, implementation, and evaluation. Then in the past we used to have 2 skill stations, which are where you go and perform. Maybe it can be CPR, it can be any skill, physical skill. While now we have 10 stations. So these 10 stations still continues to have the API, which is the assessment, planning, implementation, and evaluation. You still have this going on, and 6 new skills has been added, and 2 pairs of 2 skills. That means the previous skills we used to have 2 pairs of 2 skills. That means 4 skills, and 1 professional behavior, 1 station that will assess your professionalism, how you behave, how you're able to be professional at work, and one will assess your critical thinking, that is your evidence-based practice, how you show evidence to whatever you're doing, your rationale behind whatever you're doing. Those are majorly the changes. If you're just taking OSCE for the first time, it shouldn't be a change to you because this is what you know anyway. So just forget about what has happened in the past and just focus on what is going to happen in the future. And that is how you go through your OSCE, and usually you get your result within 3 to 5 working days. If you pass, congratulations. If you don't, you have to retake it again. Now you have just 3 attempts. So after the first one, you have 2 more attempts to pass your OSCE, and I hope you're going to be able to pass this exam. Just be confident. Even if you fail, it's okay to fail. I know people don't talk about how they failed. We don't share about how we failed. We don't share our experience. Everybody just come to you and say how to pass your OSCE first time, how to pass your English exam first time. But what if you fail? If you fail, just keep your head up. You can do it. You have to just do it, and you will do it. So just be focused, be prepared. Remember to understand where you failed or where you need to adjust that thing before you go back to it again. And I wish you good luck in all your endeavor. Once you've passed your OSCE, you're going to get a mail from NMC to say congratulations, you have passed OSCE and you are now eligible to get your PIN. You're going to pay for your NFC PIN. It is just a number, but it is very important. It's something you want to protect. You're going to get it sent to your mail once you've applied, and yes, welcome, congratulations. You're now a nurse in the UK and you can begin to work. Practice. Before all these, you may be working as a pre-registered nurse, someone who is not earning as much, and someone who is not really a nurse. You're just going to be shadowing, doing a care work or doing an assistant nurse work. But once you've got your PIN, from the day you get your PIN, you're a registered nurse. And normally you start from band 5, band 6, band 7, and you progress your career from there. I wish you good luck in all your endeavor. Thank you for watching up to this level. level you've tried. It's not easy. Remember to subscribe before you go, and please remember to watch my other videos. Thank you for all your love, thank you for your support, and let me know how it's going with you, what stage you are, and I wish you good luck, and I'll see you. Bye.